Greetings from a fishing village on the Atlantic coast. You've tuned in to podcast Portwenn, celebrating the world of Doc Martin unofficially. I'm Chesla Wexler, and we'll be discussing Doc Martin, the medicine, the mayhem, and the marvelous people of Portwenn. Podcast Portwenn is an independent fan production, not affiliated with, endorsed by, or sponsored by Buffalo Pictures, ITV, Fox, or the creators of Doc Martin or Best Medicine. I'm delighted to welcome back Lisa Verney, our resident psychotherapist, to discuss Season 7, which is the Dr. Rachel Timoney season. Who better to discuss therapy and couples counseling than someone with a career of experience? So Lisa, welcome back to Podcast Portwenn. Thanks for coming. Come through, and Happy New Year.
Happy New Year. It's great to be here again, especially with this season.
Yes. I've really been looking forward to having you for this.
I figured that. So I brought something to what we would call it a tool that I actually would use in sessions. So what this is an oil can, a really official old oil can, and then someone made it into like a card holder or whatever. But I would have this in my office, and when I'd be working with couples who challenges talking to each other, I would use this as like, you need to oil your mouth, like on the Wizard of Oz when the Tin Man is frozen and they need to loosen up their mouth so they can talk to each other. And then sometimes I would have a couple take it home and put it on their kitchen counter so they would remember to talk to each other. And that's what this couple needs.
They absolutely need it. Joan tells Martin at some point that he's constipated.
Right. There's another way of thinking about it, Chesla. That's good. So I was thinking that our conversation here today might be kind of like if Dr. Timoney came for supervision with me, meaning if she came to consult with me about this couple that she was working with to say, how am I doing and what should I do differently? So I thought that would be a good place to start. I think there's also some other elements of this season that I want to talk about with the relationships, because as we've talked about all along, all of these relationships are going through developmental stages and changes and growth, and we're hoping evolution, and really they are. So do you remember I talked about resistance, and that resistance sometimes in this season, we see Louisa having resistance to doing couples therapy, right? But it's really not just that more overt resistance, but it's again, what is getting in the way of progress? So that's something to keep in mind. Now, diagnostically, what are these problems that this couple is having? They can hardly talk to each other. Don't you agree?
Yeah, I agree. I mean, I've talked in prior episodes of the podcast just about they haven't gone through what we would really consider a normal dating period. They just go from sort of incident to incident as far as we can see, and it's typically something dramatic that brings them together, that makes them actually have some sort of a breakthrough, but they don't appear to really have what you would consider the time when you sit down and say, what sort of books do you like? Do you like to go to movies? What kind of music do you appreciate? Let's go to the museum. No, I like this kind of art, that kind of art. They don't share any of that stuff. They just seem drawn to each other, and we really don't know why, and it doesn't get developed.
That's an excellent point, that they didn't have the dating that would be more warming up.
Yeah.
I talk about that as sort of the outward in. You learn about a person from the outside in. They just keep getting into this stuck place. They also are terrible at showing each other affection.
Yes.
Just terrible. You want to scream out, just hug each other, right? So many different points. And I know Dr. Timoney gives that homework to them. You're familiar with the love languages, right? That has become pretty commonplace.
I've heard of them. I've looked at them a little bit, but I can't say I've studied them.
Right. The love languages is written, it was a book that was written, but it's become very much part of our culture. And to think about how a couple expresses love and receives love is really the point of it. And there's the 5 of them. I'm sure there's more. So one's acts of service. One is words of affirmation, quality time, physical intimacy or affection, and gifts is the other one.
Okay. Yep.
She doesn't Dr. Timoney doesn't use this, but this might be effective as a kind of educational piece. A lot of times with couples or in therapy, we do what we call psychoeducation, which is really just to teach people about how relationships work and what's going on. And because they're both so intellectual, um, and one's a teacher, one's a doctor, they would like that. That
Hmm.
would be received well. And it would help them with their resistance because they don't understand the process. So they have concerns and fears. And in fact, Dr. Timoney Martin asks her about how long this is going to take. And she kind of isn't very warm and fuzzy toward him about that, right?
Mm-mm.
She kind of just says, "You need to trust me." Well, why would he
Right.
trust her?
Yeah.
She appeals to his, "You're a professional, I'm a professional, I would listen to you," and that's helpful. That's definitely helpful to him, but in terms of teaching him about trust and being a little bit warmer and modeling that, she's not terribly warm either, don't you
That's
think?
true. Yeah, I think she's more of the scientific type, which I don't know if that's an act because it certainly, like you said, that would appeal more to him than a touchy-feely person, but then it has no chance of really working with Louisa.
Right. So I want to go to the other thing I wanted to say was in terms of the psychoeducational piece. I like to think of this as like a three-legged stool in relationships. The ability to say thank you, I'm sorry,
Mhm,
and I love you.
mhm.
And boy, those three things are hard for people.
And it seems to me like that's the oil in that oil can too.
Good point. And they
Yeah.
don't really have that skill too. So the kind of way that I would work would be like this. I would be playful. I would bring humor. It's very different than I don't know how they all do it over there. And again, this is a TV show, but I would want to be modeling some of that. Now Martin might not tolerate that too well, but it might work with Louise a little bit more. I love that Martin presents with his diagnosis. I mean, his vulnerability, I just feel for him. I know he's such a tough guy to deal with, but he's so earnest in this season. Do you find that?
I absolutely do, and I was making a list before we started of the things that he did and how much he's trying, and you think about it, he expressed in the end of season 6 how he knows he's not good at it, but he wants to be better. You see him saying that he made 1,000,000 phone calls to Aunt Ruth because he can't find anyone appropriate, so he's obviously been seeking help, wants her to do it, she won't do it. She suggests somebody, he makes an appointment right away, I mean, it seems like that day. Things get in the way of it, but he still perseveres. And when he goes in, he knows he's been researching it. So he's obviously been looking it up. He tells her what he thinks he has. He tells her why he thinks he has it. And he admits he thinks the problems are his fault. He's just ready to accept it all.
Right. So the resistance to therapy, to looking at himself, that's been softened in previous seasons. And we know
Mhm.
because he almost lost her, that was and still may. We don't know as the season starts. I meant to go to the episode where Louisa comes to see Dr. Timoney. So in therapy talk, we use the word countertransference. And what countertransference means is how the therapist feels about the patient and what's going on in the room. And what we're taught to do is if we feel something, to first go back into our own history and consider that we have something going on in the room that's triggering something old, and to really account for that and work on that, to not assume or assign that to the patient. And after we do that, and it can be going on all the time, but also when we're not in the office and we're thinking about the work. The other part is to consider, is it something that's coming from the patient? Is this something that the patient is feeling that isn't being articulated, that we feel like, for example, I would be feeling some compassion for Martin, hearing right away he tells me this story and he's so matter of fact about it, his background, his history. and the vulnerability and the fact that he's so cut off, and I would be feeling kind of this awe for him, like, this softness for him. But realizing that, okay, that may be coming from something in my background, but it's also coming because he doesn't feel it for himself, right? He hasn't been treated that way. He doesn't feel it for himself. He feels it for Louisa at this point. But I'd be recognizing that that's something that's cut off. And I'm feeling it in part because it's cut off from him. I'm sensing it. I'm aware to sense it. Now with Louisa, she's incredibly frustrating. I feel very frustrated by her. And so the fact that she doesn't consider anything about herself, but that he's not voicing any frustration. Dr. Timoney says to him, "Well, what about your happiness?" But he
Mhm.
won't go there at all. Before I go on about the session, any thoughts about what I'm saying?
Yeah, I mean, I thought he was very, like, that very matter of fact saying, "I have attachment disorder because of these reasons," and when she wants to know what he wants to get out of this therapy, it's he wants Louisa to be happy, he wants her to stay with him, and she asks straight out, "What about your happiness?" And he's like, "Happiness is overrated." And she's like, For you, but not for your wife." Like, you think it's a valid goal for her, but it doesn't matter to you or it's not valid for you, and we don't really know. I've always thought he doesn't think it's valid for him, almost like he can never be happy,
Right.
or he's just put that armor in place that says, "Happy makes me vulnerable, vulnerable is painful, therefore, if we eliminate happy, then there's less vulnerable, there will be less pain."
Exactly. So sitting in the room with him and as an initial couple of sessions, we don't know how many times he's there, I would get this sense of him. And Dr. Timoney's doing a pretty good job of that, I have to say. And dealing with he has this real defense of the armor, the intellectualism, he's not connected to his own vulnerability at all, except with his pain about not making her happy. But I just love this session with Louisa. So she goes and she right away she plays it great. Martin has difficulty expressing his feelings, and says he comes from this emotionally repressed place. The mom is very cold. And Dr. Chimney absolutely does what one would do is we want to know about her too. But we're also, when we ask that question, it's 2 things. One is, let's see how far she goes with this, right? Does she receive that? Is she resistant to is she emotionally defended against talking about that? And she is. She kind of right away, she is very dismissive of normal history. And then she says that after the age of 12, she didn't need a mother anyway
Mhm.
and a father's wasn't relevant, which is how she treats Martin in some ways, that he's irrelevant. And then she says, I don't know what this has to do with Martin. So it's all about Martin. She cuts
Right,
me off
yes.
and
What
says,
why are we
why are we
discussing
talking
me?
me? Right. It's Martin's problem why we're here. Full disclosure, as a therapist, like this would make me nuts right here inside. This would make me nuts because it's never one person. Not ever, but what I'd be feeling with both of these people are, like, I have my work cut out for me. They have a
Yeah,
lot of defenses here.
yeah. I can only imagine. Like, I've never been in your shoes, but just as a viewer of the show, you watch these 2 and you've got him so repressed, but willing to work, and her so forward as long as it's not her who's at fault.
And it's incredible, her lack of insight. I have to say, though, that after watching this season, I thought, do I really wanna be retired? I miss this work because I would often tell people I'd work with that when I'd be presented with something and I'd say, "Well, we have to work on things." And, at the end of a session, I would give feedback as to what I'm perceiving diagnostically. So again, that psychoeducational piece really helps hold the environment for people to give them feedback, tell them what I'm thinking or feeling. And I'm teaching them. I'm not just doing therapy with them, I'm teaching them. Um, but I would say, like, there's work to do. I'm not hopeless. There's things I can do to help them.
Right.
So I would be
Yes.
optimistic. And what I'm weighing at the beginning is, are they going to stay with the process? I think that too often we forget that these defenses are in place and they're going to operate in the therapy. They both have attachment disorders. So their attachment to me, it's going to show up with their attachment to me. And I have to, in fact, would be the way that I work. I can't just give them homework assignments if they're not going to stay in therapy. The attachment issues are going to come in the room, and how they feel in the room. I would be a therapist who would right away ask them that. How are you feeling? I call Luisa's attention, maybe not right at that one moment, but pretty soon I would ask her how she feels in the room. Now, we don't have to ask her because what does she do? She deflects and she says, how old are you? What do you know? Which
Mhm.
is really another tricky situation to turn the tables.
Yeah, because Louisa's older than Dr. Timoney.
Right. And to turn the tables and say, what do you know? So she really could put her back on her heels, but Dr. Timoney handles that pretty well. And Dr. Timoney says she wants her to come for couples therapy, and Louisa says she'll try to keep an open mind, but she's really not into it. I
Mm-mm.
did go back and revisit because I was thinking, okay, I had forgotten, what made Louisa decide to go?
I thought Ruth was brilliant.
Exactly. You want to say so or shall I?
Let me, I'll give you my impression of it. You can
Okay.
fix me. She basically, I think she encounters Louisa at Mrs. Tishel's, and she baits Louisa's curiosity
Yes.
and willingness to be defensive because she's like, don't you want to hear his side? And don't you want to make sure your voice is heard? Like you're making your case. And I thought,
That was brilliant.
chef's kiss.
Now that's another way of dealing. She's dealing with Louisa's resistance.
Hmm.
The way she did it was so clever and so Ruth. And again, Ruth is used to dealing with very difficult patients.
Yes.
Then the other thing that happens is that there's the incident with the radio woman's niece or friend,
Right. Yeah. Ellie, who's singing about pigs,
right? It has the
tracheotomy.
right, and it's recorded over the radio, and Louisa hears what goes on, and she says to James, "That's your daddy." So there's this admiration that comes back, and this is a theme, right?
It is a theme.
And then she decides he's a decent human being. She sort of remembers that or sees something. What do you think of that? It is a theme that she tends to circle back when she sees him being such a good doctor.
I'm I'm hesitant to say that it's like she sees him being a good doctor and a special person in the sense that he's a caring guy, even though that does come back before the end of the season. But I just feel like she is super impressed by his skill because it seems to be when he does something remarkably skillful, and it tends to be a surgery, right? Because he does the Peter Cronk surgery and he's brilliant. He does the whole, multiple resuscitations of Holly. Like how many things can he pull out of his pack of tricks to get this woman to come back to life? And then here he is doing an emergency surgery. And she knows the whole blood phobia thing. So she knows this is not easy for him. Yet he puts that aside and he goes through and he fixes the person and he helps the person. Because there's nothing tender about Martin in a situation with Ellie, right? Because she's just not breathing and he's telling people to shut up and you do this. So he's not being a nice guy, but he's being incredibly competent as a doctor. And she's always wowed by it. And the common theme with Martin seems to be she's very beautiful. So I always feel like, okay, he loves her for being beautiful. Like that's his draw. And her draw is she's amazed by his brilliance as a medical professional. Because otherwise we don't have a development of the relationship in any other way.
Now, and he also loves her because she's a good mom.
Yes. Yes.
So what's underdeveloped in Louisa is her own insight about herself. There's this level of narcissism to her, and we see it so painfully when they do this homework of hugging each other, and she doesn't say anything.
No. He is the only one who's ever done it spontaneously, and then when he actually does his hug and his compliment, her comment is just, "You're really dedicated to this." It's like that wasn't a compliment. It's kind of a compliment, but it's more like a comment, and she could have just as easily said something like, you know, "I thought it was really nice that you gave me a lie-in and took care of James when I came back."
Right, something.
Yeah, and it seems I started listing all the things that he's doing in this series. He's the one who takes the horrible flat, even though he owns the surgery and that's where he works. I mean, he's the one who's trying the hardest here. Makes me so mad.
And he also won't point it out to her.
Right. And she doesn't, I mean, she does say thanks for doing this, like even when he's in James's room and she does make sure, like, are you comfortable? And she thinks to bring him the clock and thank you for doing this. So there is a little bit of thanks, but it just seems to me, and of course, I'm on Team Martin, but it just seems very one-sided to me how this season goes.
Again, going back to the supervision part, so, like, what would I do with this? And I have to be careful because there could be this triangulation going on. So let's go back to that I would be feeling frustrated, right? I would have to be careful because in Luisa's background, or both of them, but Luisa's background, she's not cared for. She's not mothered or fathered. So I'd have to be very careful not to reject her because she's easy to reject in a way,
True.
or to
Yeah,
be
and she's
critical of,
always been rejected. Yeah.
right? So some of the going back to the compassion for both of them, the affection, teaching them, just being a little humorous with them. They might have a hard time with that, but they would see, like, they would have that model of
Mhm.
how to be all of those things. The other thing that's changed over the years in the therapy world is the use of self-disclosure, and both not telling people per se about other patients, I don't mean that, or so much myself, but giving them examples. Say, I once worked with someone, even if it's a kind of made up thing, or even sharing something about myself. I wouldn't be, in some ways, being some more self-effacing with them in the room would teach them that that's part of how we smooth things over in relationship, being able to laugh at oneself.
I could see that as a modeling because you're especially if you've earned respect
Exactly.
and you're showing, like, I can laugh at myself, I can joke with the other, I can absolutely see how that could be helpful in a therapeutic session.
And also that I always was very much about catching the good in my patients as a way of modeling and building those muscles for them to see it in themselves. Remember in the beginning I said that they have to develop this relationship with themselves, how they treat
Mhm.
themselves and between each other. So anything that they did good, I would be accentuating. We call it, there was kind of a way to prescribe the behavior. And if you see a little bit of it, to praise it as if it were a really big thing because they're growing into that behavior, kind of like a pair of shoes they don't fit in yet. But once they grow a little bit into it, to say, look at you, you did do this, so that if people haven't had an experience, you can't just say you're not doing it right. This is the mistake that parents make a lot with children when they're disciplining bad behavior, but then not asking the child to do the good behavior and then reward it. Because how would they know the good behavior? You have a thought?
Yeah, I'm having a thought,
Yes.
and it probably they're probably coming up from the fact that one of the reasons I like this show is because I see so much of myself in Martin. Okay.
Mhm.
And I wonder with him, because I know this is true for me, if you give me a compliment, that actually raises my hackles and I actually have resistance to it. And if you look at him throughout the series up to date, when somebody says something nice to him, he tends to just be like, yes, or, you know, duck his head, or he's not comfortable being complimented. And it makes me wonder whether that would be helpful to him to be compliment like, or would it just make him more uncomfortable?
Well, again, I would always bring everything into the room. So I would make the compliment because I know from the attachment healing that he needs to both work through the criticism, but then also have the positive feedback to learn about relationships, right? He hasn't had that in his background. So in order to have a corrective experience, I'm going to want to offer it to him. However, yeah, I'm not going to do this with you. When his hackles come up, I would be noticing that. And I would notice that with him. It seems like something happened when I paid you a compliment. What did that make you feel like? And how come? Because in order for him to receive love, we would have to work through that. We would
Mhm,
have to understand that. And again, they're both curious people. They are, even though, Louisa, it doesn't seem to be about herself and about therapy, but Ruth calls on that trait in
mhm.
her. So, as the therapist, trusting that I know I'm doing the right thing, even if someone's hackles are going to come up, because I know that's the direction we have to go in to heal. And that's the hard part about the work, to stepping into places that people are very uncomfortable with or, aren't going to like that I did.
Yeah. Yeah, if you don't go there, no growth happens.
Exactly. And I can't tell you how much I would have to talk about what it felt like for people to receive feedback, positive feelings, love, because there's all kinds of defenses around that. That's the
Yeah,
problem.
right. That makes sense. Uh, I thought it was interesting when he hugs her and he gets stuck, right? But she doesn't know he's stuck and he's
Mhm.
having trouble letting go.
And
And
eats
she's like,
that.
I'm not going anywhere.
Right. I'm so glad you brought that up because I was going to also. What do you think about that?
Well, I'm not going anywhere is the exact opposite of what she usually does, is she goes
Exactly.
somewhere. And
Right.
it was a spontaneous comment on her part
Right.
to say that. But
Right.
so you wonder, is that a deep-seated how she feels? Like, I'm not going anywhere. Has she decided she's staying? Hard to say, but it was just an interesting spontaneous comment to what she thought was him having a moment.
Exactly. And she leaves in big, real ways and small ways. She is, and this is what I said to you earlier on, when we talked in previous podcasts. Every time she doesn't respond to him, she is leaving.
Yeah, true.
She's leaving the intimacy and the potential intimacy. And in fact, it's after this that she announces, remember, they're outside of the surgery, that she thinks they should think about being done. Remember?
Yes, I think what she says is Dr. Timoney suggesting we divorce.
By doing this, what things are like, what would be good about being single, which I have to say, I know they did it, it's the story, but if Dr. Timoney was in supervision with me, I would have said that that was ill-timed,
Okay. Yeah.
that they had nearly done enough work.
Yeah. I think you're right. I mean, it's a TV show. They had to kind of speed things up, right? But I thought it was interesting in that they both kind of come out of there a bit shell shocked, right? And
Mhm.
Louisa's like, I wasn't expecting that, and is she suggesting we divorce? And Martin clearly sees she's suggesting we make a list, and we should do it because we want to see the process through.
Right. And I have to say that early in my career, because I'm married and been married for a long time and believe in marriage and saw my parents do that and my in-laws do that. There were couples that I ought to have introduced them not being together.
Mm,
It took me time to realize that it's not taboo to introduce that. And in fact, there were times, as I got more seasoned, where, let me see how I explain this. Remember when I talked about couples coming to therapy and that the similarities and the differences, and that if couples are both there and they're both frustrated that their marriage isn't working and they want it to work, that's different than two people being frustrated with each other and contemptuous of each other.
mm,
That's a different situation. The first one, And that's what's going on in this season too, is they are hurting. They want this relationship to work. So
Yeah,
when
I
Dr.
agree.
Timoney brings that up, it's actually misattuned to where they are.
Mm,
And it may reflect her lack of experience. It
'cause
may
she's
reflect
young.
that she's not married or something like that. Because, those of us been married a long time, I mean, it's hard. You go through hard things. You can't just give up so easily. But at times in the second instance where people are really fighting with each other and sort of opposing the therapy like that, not the way they did, they're using the therapy then. They're using the therapy as this way to be destructive toward the other, right?
Mm,
Where they're blaming each other, they're not taking accountability. They're just using the session to kind of perform their tensions and their anger and, attacking each other where it's not productive.
mhm.
So there would be times in working with couples that I might get to the point where I would say to them, why are you, essentially, why are you staying together? Let's think about what it would be like. And that does snap them out of it.
I'll bet it could snap them in different directions too, right? It could get them to be like, "Oh crap, if that's really obvious, and that's not what I want, then
And
I have to do
she's saying
something
that,
different."
and the therapist is saying that,
Yeah.
and the stakes are higher. You see what I mean? Like, people get into these habits of they think that this is forever, this is the way they do it,
Mhm.
and they're not gonna quit. But it's so self-defeating. So, I just think that that was not well timed, and it fed right into Luis's resistance.
Yeah. Yeah, interesting. Yeah, it was a surprise when she said that, but you could kinda see that as a show plot with 8 episodes,
Right.
they had to kinda move things along.
And if Dr. Timoney was in supervision, I might say to her, "What made you do that then? What are you
Mhm.
feeling, Dr. Timoney, or what's in your background?"
Mhm.
Because something was getting in the way for her. And we see at the end of the season, right? She has the
Right.
concussion, so she acts really kooky, which, okay,
Yes.
is fine, and, Martin saves her and all of that. What I wonder, Chesla, is all these people are practically dead, and they have to hoof it up to the surgery, when they're having these crises down at the harbor.
Yeah, yeah, that's true. It is, and I'll tell you, having done the walk, wow. I mean, when I just a little aside here, but I'm very athletic.
Yes.
And when we were in Port Isaac and we stayed at the surgery, so we were up and down that hill a lot. I give Martin Clunes a hell of a lot of credit for sprinting down that road
I know.
because the grade of that road is ridiculous. I hope they had somebody at the end of it who would catch him if he went flying because frankly, you could really hurt yourself.
And he was in those dress shoes. I hope they had, some rubber soles on there.
I hope they did.
Even in the part where with Danny, we can get to next, but he's running in the woods and stuff, and he's going in the like, he'll do anything for the patients, right? He'll run through the mud, he'll slip in the
Yeah.
pigsty, he'll fall in the creek as long as he's doing that.
And as another aside, since we're here, I also had written down when I was taking notes on the season how much I thought Martin Clunes's physical humor was very good.
Oh, I agree. And his facial expressions, scoffing at things, and it was great. But just before we leave Dr. Chimney, so, at the end when she comes to the surgery and she tells them that they're this, horrid couple. She doesn't use that word. What does she actually say? I don't remember. But she said she's one of the most difficult couples she's worked with or something like
Yes.
inappropriate.
Yeah. You hope that's still the concussion
Exactly.
or the orbital lobe damage or whatever
Right.
it was, because she's violating all sorts of medical things when she tells Mrs. Fischel,
Right.
like, I'm counseling them.
Right. Right. So again, we all can learn no matter how seasoned we are, no matter good we are, we can always learn. And so there were some things. So again, I don't know if your audience is interested in that, but I wanted to say those things. Now, going back to some of the other characters. So it was interesting that they brought Sigourney Weaver in to this, right? And she brings the American into the village. And everything I say, it's hard to know because culturally, I'm American. I have worked with people, like, I worked with someone who was from England, Ireland. So, it was interesting to have the difference in their relationships, how they would deal with their relationships with Americans. They were married to Americans.
Mhm,
Anyway, she comes in and she teaches Morwenna about being assertive.
mhm.
I love that.
That was great, and she uses it.
If she gets a raise, negotiates, she tells everyone to leave the surgery. There's nothing wrong with them. She gets Al to stand up. So I thought that was great. And Sigourney Weaver stands up to Martin.
Yes, yeah. Although he does get that last zing in, right? "I can't understand you, your accent is very thick."
Right, right. But what an interesting person to just be in the show. I was going to look that up. Do you know how she came to?
I know the backstory. Selena Cadell, who is Mrs. Tischel, and Sigourney Weaver are long friends, longtime friends. And I guess Sigourney Weaver had been on a talk show with Martin at some point, completely unrelated, and just dropped a comment that she loved the show. And so they thought, well, let's see if we can get her on.
Okay.
Beth Trawick.
So Mrs. Tischel, I love
I
her.
love that woman.
I just love her. She gets better every time. So I love that she keeps saying to Martin, and she does it in the pharmacy. She does it outside his door. That they're soulmates and just not in this world. And the fact that she goes back with Clive, I think is just lovely.
Yeah. Yeah. He's so smitten with her. I mean, you just have to love how Clive loves Sally.
I know. And then they eat together, and she's all sexy and everything. So I just love that. Also, Bert and Al. Bert is so sad at the beginning. That's heartbreaking. Just heartbreaking.
When Jennifer breaks up with him.
Yes. And then and then, he sets out with this whiskey making, and, it ends with Ruth getting involved with that, which is great.
Mhm.
But Bert and Al both are really they're two of a kind in one way, right? Because they're both always trying to figure out how to make a living,
Mhm.
but they're good partners, right? They're very caring people.
Mhm.
The show is really needed them, right? That they're an important part of the show in that they take care of everyone. Their humor, they're always humorous. And I want to go back too to say that
Just with respect to Al and Bert, I kind of think that they are a little bit of yin and yang. Al is always trying to make a living and Bert's trying to make a living. Al's living is always above board and reliable. And he becomes like the reliable part of even when he's not involved with some scheme that Bert's got. He's the one who's trying to clean up after his father. One thing I wondered in this series was I thought we learned in an earlier series that Al had bailed Bert out when he got into debt. So Al was now 90% owner of the restaurant at one point. But then Bert just closes the place up. And we never hear a word about it. The fact that didn't Al just kind of lose a huge nest egg? We don't get an explanation of that. But you can always trust Al, and you can almost never trust Bert.
you can never trust Bert business wise,
Yes,
but he's so present in the village in terms of showing up for other people or trying to show up for other people.
agreed.
He's like the
Yeah.
heart of it in some way.
Like he's the one who welcomes Louisa when she comes back pregnant. She's the one, no judgment, just waves at her across the harbor, right? Holds a baby shower for her. So yeah, you're right. He is always the tender part of things.
And that's, I think, where I mean that they're similar. They're good people, both
Hmm.
of them.
Yes. Yes.
And then here's Ruth seeing something in them too. Who else was I going to talk about? We just mentioned them. Penhale.
And Janice, yes. Yes.
Poor Penhale.
He's just so confused about whether he should go to Exeter and take that transfer. And not a soul will give him a piece of useful advice. Dr. Timoney even just walks away on him, which of course she hit her head, but he doesn't know that. So talk about feeling like he's completely alone in it. And then Janice, who he's already said he professes love for her, right? When she's walking away from him at one point, she doesn't hear it. But then she's the one who comes to the rescue, gives him some advice. I was wondering there when she talks about having a 2-for-1 fish and chips at the end.
Mhm.
Is there a subtext to that conversation?
A good one, Chesla. Yeah, I think yes.
Because, I mean, he's like, "Both the chips and the fish? Or
Right.
just the one thing?" No, it's for everything, and it just seems to me like they're having a conversation on a completely different level.
Yes. Yes, and he stays.
He stays. Yeah, which is nice because we need a cop in town.
Right, everybody's evolving, right? The relational piece, they're all evolving. They're all having deepening relationships.
And I think we learn more about Ruth too. One thing in the prior episode, it hasn't aired yet, it'll be airing soon. I talked with Judy, our newbie Judy, about seasons 5 and 6. And so she met Ruth for the first time, and she was saying that Ruth wasn't what she would expect for someone who would be the psychiatrist in a prison for the criminally insane, that she's sort of nun-like and diminutive and things like that. And I think in season 7, you learn more about Ruth. You saw some of it when she was with the Dunwiches and she was negotiating with a gun, right? But you learn more about Ruth in here, that she's got a real steel spine to her.
Mhm. Yeah, so that whole end part, which is when really Louisa, that final crisis when Martin's kidnapped and she won't leave his side. Remember, she runs after him and she's
Mhm.
sticking by him, and that's very symbolic because she decides to do that.
And
And
he, to
he
his credit, right, he negotiates with the kidnappers to say, I will help you with him. You keep the cop, but you let my wife go. So he's always thinking of Louisa. It's just yet another example. And she is like, I came here to find you and I'm not leaving without you.
right. So again, the all the village crises continue to help put them together. Now we'll see as time goes on how well they're gonna do.
Yeah. Well, I think Louisa has an epiphany there. I mean, at the end, when she finally says, I think I've been wrong all this time, that people aren't just normal. Things are not just normal. People are unusual. You're unusual. I'm unusual. And yeah, and you see poor Martin there basically when he's telling her, I'll never change how I feel about you. I've tried and it makes things worse. It's like I read into that he's saying, I tried not to love you. I tried to withdraw. I tried to, change myself so that you would not be the one person for me. And I fail at that.
So that's an example of when there's a crisis, which there was, he was kidnapped and all that. There's an opportunity for growth because the defenses are down. So
Hmm.
they both are more honest. They're willing to take greater chances. They say more. In real life, the stuff that's in their way won't go away that easily.
Mm-mm.
They still have to live and practice.
Yeah. This is TV land, right? So it makes it look like it could be easier. But in TV land, it's easy. In real world, there's a lot of work that needs to be done.
But it's great. But it's great that that would have happened to have that breakthrough.
And I like the fact that at the end, when Joe is saying we're going to have a serious talk with Annie and Jim Wynn and Clemo, right, for having taken Martin
Just
hostage.
serious talk.
Yeah. Martin comes to their defense and he's like, you really need just to do a psychological evaluation here. And I think Annie Winton, she models some behavior for them. She is basically the person who's like, when you love someone, you will do anything.
I thought also that's an excellent point.
And Martin, this whole season, may not have been giving Louisa what she wanted, but you can't fault him for trying to do everything that he could figure out might help.
And she wasn't offering much back.
Yeah. Now, what do you think she may have communicated to him that she does want from him that he still doesn't give her? Because the only thing that I could really think of is his awkwardness in communication and stuff. Like he's not social, and he he says things that she would prefer that he doesn't say, or he says them in ways that she would prefer he doesn't say. But other than that, I don't think she's really given him a heck of a lot of information of how to make her happy.
I don't think she totally knows herself yet.
Mm.
She's not very conscious of what she's doing yet. I don't know that she will become that way, but yeah, she would say, stop being so particular about everything. He's misattuned. He says he doesn't say as many misattuned things here. He's better at that in this. And I would, if I were their therapist, I would point that out to her because she's not good at seeing the positive. Maybe that's the way she is as a teacher too. Maybe that's English, how they do it there. I don't know if compliments are praise is very has high currency, but she really melts when he gives her positive attention.
I thought it was interesting when Dr. Timoney says you need to do a date.
Mhm,
And Louisa gets it like a date, and she knows what a date is. And Martin's completely like, "What is a date?" And it's like, "Well," and she explains it very technically, like,
mhm,
sometimes 2 people, even if they're married, will go out to a restaurant, or maybe she didn't say even if they're, well, they'll go out to a restaurant. I mean, like, out to dinner, to a restaurant for a meal. He's like, and he grabs it like, "I can do this," right?
brings flowers.
And he takes her to where they met, to
Yeah,
the table where they met the first time. So he actually thinks it through, like, how can I make this not just dinner at a restaurant, but I can make this even that much more significant, which I gave him a big thumbs up
yeah,
for.
he is totally learning, and then she runs off with Danny. We didn't talk about this, but
Yeah, Danny.
she runs off with Danny, and I love how tough Martin is on him. And, eventually Louisa is also.
Mhm,
But he is giving her a lot. He is paying attention. He is conscious about what he's doing. Martin is at this point.
mhm, yes. Yeah, I agree. And Danny, boy, trying to move in on Louisa, boy, oh boy, made me unhappy.
Yeah.
I never
So,
really liked him,
yeah, he's sort of weaselly.
and he treats her poorly. She's convenient when things aren't going well for him. She's a nice, you
And
know,
also, how much can you love a person if you're taking advantage of their situation that they're struggling in?
true.
Like, can you really
Yeah, you
love?
just want what you want and you see an opportunity. It's not necessarily, is there a way I can support you guys? He doesn't offer to pray for them, which would have been in the character he was trying to pull off.
Yeah, but he wasn't being very, even with the children, he wasn't being very much of a leader that way.
Let's sing it out when a child's missing. We'll just sing about it till you guys show up. What a, you know, helpless adult.
Useless.
Yeah,
He wasn't very adult. That's the point.
yeah. That was just an age and not a maturity level for sure.
Exactly. Exactly.
We finally get to the ending of season 7, and the helicopter takes off, and they have this nice discussion about who's unusual and all that, and then where do we end?
See, to go back to that too with the unusual, that is such a healthy way to be thinking about and a sign of maturity when we can say we're real people. We have, going back to that, we have flaws and we have beauty, right?
Mhm.
Which I said in the beginning. There's no normal and we're all a work in progress. That's another part. But they negotiate this and they say I love you and at the very end, right?
Yes,
Or yeah. Um so it
that's
ends
how
with
they close. They have this nice kiss,
yeah,
I love you," and their heads touch, and it's very sweet.
right.
Yeah. It's a good season. It was a better season than I remembered. I thought it was going to be a difficult one to go through and watch, but then I think I was really remembering season 6, how season 6 was so hard because it was just such a slog for the 2 of them, and, this was hard, but at least it had hope,
Mhm.
even though it looked like we were losing our hope there for a bit, and then we have, as usual, a crisis.
And the other thing too, when people have children, this goes back to the therapist also. I would implore a couple that they would have to work hard.
Mhm,
Usually couples do want to try to make it work if they have kids. Again, if they're in that first category where they want it to work and it's not working.
mhm.
Um, but to step aside, to me, that's such a repetition of what happened to say, you should be apart now. And she wasn't, I know Dr. Timmy wasn't saying that, but she shouldn't have even brought that up at that point.
Mm,
It was
mm,
not appropriate. But that would have been such a repetition of what happened to them.
yeah,
And
true.
for James. So the other thing, remember when I said in the previous time we talked that when people have children, it brings up all their old stuff?
Hmm.
The other method that might have been helpful for them is to let them think about what it's like for James.
Yes.
And then they could have imagined, what do you think it was like when you were James's age? How are you similar or different? What do you want to give to James that you didn't have? And again, that would have been something they're working on together.
Hmm. Yeah, that makes perfect sense. And she never did go there. That would have been a very interesting angle to pursue.
Yeah, I loved her where her office was, Dr. Timoney. That was a lovely location. It wasn't
Yes.
very warm inside the office, but it was beautiful outside.
Cornwall's hard to beat when it comes to beautiful locations, I'll tell you. Well, this has been super. Yeah, I so appreciate the fact that you give us your expertise and you review the seasons so that you've got it fresh in your mind and you think it through and you come here and you share it with us. People don't know today is New Year's Day. Lisa actually rearranged some things so she could be here with me. I really appreciate that. You're welcome back anytime. We're looking forward to the next session, which I think we're going to do 8 through 10, and that'll wrap up the psychology aspect. And then you can just be a know-it-all fan.
Well, I needed to watch it all over again. One, because my mind is like a sieve and I forget details very quickly. Partially, and more interested in the plot.
Hmm.
But rewatching it, then I really put my therapist hat on. And even as I'm watching it, it's hard sometimes to do that. I have to take notes and then think about it from a different perspective. Sometimes people think that therapists run around and are just analyzing everyone. It's like, no, it doesn't work that way. You really have to, you know, like when you go to work, you put your hat on and you do it. So it's my pleasure. It's interesting.
I'm glad you actually brought that up because I've always wondered that, and it's like they even bring that up in when Ruth first meets everybody. They just assume she's analyzing everyone, right?
Right. Well, and you go to Doc Martin, he is literally observing everyone and everyone's medical problems.
Yeah, yeah. He can't get away from it mentally, can he? He's diagnosing everything that he sees. There's a mole. There's a there's a
Right.
this. There's a that.
I think for a therapist, it's more you start to get a sense of something. And again, that internal feeling, and you think, "Oh, what's going on here? Something doesn't fit or something's off." But no, that would be way too tiring to do.
Yeah, yeah. I'll bet. I'll bet. Well,
Yeah.
listen. Thank you so much, and happy New Year.
See you
Say
too.
hi to the whole family, and
Thanks.
we'll definitely have you back.
Okay. Thank you. Bye.
Thank you. Podcast Portwenn is an independent fan production, not affiliated with, endorsed by, or sponsored by Buffalo Pictures, ITV, Fox, or the creators of Doc Martin or Best Medicine.